Okay, so we're evaluating Autumn's acne scars. And if you look at natural lighting, you'll see, sort of her scars are not that obvious and not that accentuated. So we have to look at scars with side lighting. So I'm going to slowly bring this light around, and you can see that her scars are far more obvious on side lighting. And this is how we measure starting points and improvement. And the scars become a lot more obvious. And before we start, we always mark the area. We ask the patient which scars bother them most, and we make sure we address those in particular. Are there certain scars in particular that bother you more than others?
I'd say specifically the pitting up near here, and then some of the more ice-picked marks along here and on this side as well.
Okay, so we're circling some of the rolling scars, and we're going to add some filler to elevate those. And most of her scars are more boxy and ice pick. And a lot of the scars in the temple are very atrophic, meaning that they've lost a lot of volume, and those typically require volume replacement. So we backfill these syringes with velour filler, which has specifically been studied to treat the rolling scars. And we're essentially recreating the volume of the scar. And we use a bit of a fanning technique combined with a volcano technique, and we're able to see scar elevation fairly quickly. How are you doing?
Very good. It does feel like a slight prick, but it's not uncomfortable at all.
And once we apply the filler, we will vigorously massage it. So I'm going to do that now. And the scar elevation is apparent right away. And I've had multiple patients be somewhat astounded by the improvement that they see immediately. Now the technique we're using by and large is used for distensible rolling scars. So these are more saucer-shaped scars that have lost their volume but can be distended upon lateral pressure. So if we take a look at some of Autumn's scars here, if we stretch the skin, the scars are still present. That means that there's still some tethering below the skin that needs to be subcised. All right, so we're now proceeding with CROSS, which stands for Chemical Reconstruction of Skin Scars. And traditionally this was described in Korea by a group that used trichloroacetic acid. And what that does is it basically denatures the protein and wounds the skin to create new healthy skin. And we're actually using something different. This is called phenol, and also known as carbolic acid. And it has been studied as well. The advantage of using this over TCA is that this blisters, whereas TCA cuts. So it's possible to widen a scar much more easily using TCA. So the risk of widening one of your scars is going to be far less with carbolic. And the results appear to be equivalent. And so what this chemical amounts to is essentially a medium depth peel. Treated the first side, we frosted the areas, shift our attention to the left side, and now after that you can see the blisters that form from the chemical. Can I get a cotton ball, please? I don't feel much right now. It hurt?
A little bit.
Not much, right? Okay. Originally the technique was described using something called a no-core needle, which is basically a needle with a blade on the tip, and that's since been modified by a number of people using a blunt-tipped cannula. So this is an 18-gauge cannula, and it's blunt-tipped, so the risk of bruising and hematoma is far less, and it reaches extremely far. So here will be our introducer, and we'll be able to reach all these areas with just one entry. So we won't have to make multiple. With a no-core, you have to make multiple entry sites, but with here we'll reach everywhere. And Autumn's had no sedation, no Ativan, no Versed, no pain meds before. Most people can tolerate this without sedation. Okay, and you can see some of the contour changes here in the skin that were not apparent before. So this allows us to see where the areas of tethering tend to be. This is through an area of numbing, and we conveniently place this at the sideburn so there's no marks that you can see afterwards. So this procedure is done for rolling scars that are tethered and non-distensible. and they're done for boxcar scars as well. They help with those too. And once we get the rolling scars to be distensible, where we spread them and we don't see them anymore, that's when filler comes in. Okay, now, I need you to tell me if you're feeling any discomfort right now.
No.
Do you hear popping?
Absolutely.
Okay, the popping are the bands that are pulling the scars down, that are tethering the scars, sloping them downwards. So the more we break, the less sloping of the skin and the less contour abnormalities you'll see. And this, to me, is music to my ears, because I know we are breaking the bonds of scarring. We're in the subcu plane, where there's very few nerves. And if we stay in this plane, the infiltration is very tolerable. And this tumescence or swelling happens quickly with this pump. Push on your ear just to keep the cannula positioned. And turn you a little bit more this way. Good. So we have a Erbium 2940 fractional ablative laser. So this concludes Autumn's Acne Trio procedure. She's going to be swollen for a day or two. The swelling will sort of go down and settle probably in about 48 to 72 hours. She's going to have some scabs that will develop. She'll simply use some gentle cleanser, a thick ointment such as Aquaphor or Vaseline, and she'll need to be careful in the sunlight for the next few weeks. Some of our patients who are more darkly pigmented will go on to develop hyperpigmentation, and we're very careful to monitor them for that. So we'll often initiate bleaching cream regimens starting around 2 weeks. We'll reevaluate her at about a month after today's procedure to determine her response and what we need to do for her in the future. And her next session will be scheduled around 6 to 8 weeks from now.